Hey everyone, welcome. I'm absolutely thrilled to have you here for today's explainer. Today, we're diving into a genuinely monumental shift in human history, one that's literally unfolding right before our eyes in the world's most populous nation. We're going to unpack the freshly released 2024 Sample Registration System Bulletin, or the SRS Bulletin, published by the government of India. Now, I know what you might be thinking, but this isn't just some dry spreadsheet of statistics. It's actually the vital heartbeat of over 1.4 billion people, all captured in data. We're going to explore some massive leaps in public health, the shifting dynamics of how populations grow, and of course, the very real challenges that are still out there. It's an incredible story of transformation, so let's get right into it. All right, to keep things moving, here is our roadmap. We'll start with India's demographic transformation, move right into the birth rate shift, then declining national mortality, saving the youngest lives, and finally, we'll wrap up with the tale of two Indias. So, kicking things off with Section 1, India's demographic transformation, essentially a 50-year journey of public health. I want you to just think about two numbers for a second, 129 and 24. If there's one overarching theme to this entire explainer, it's absolutely the theme of progress. Because back in 1971, out of every 1,000 live births in India, 129 infants didn't survive their first year. Fast forward to 2024, and that number has plummeted to 24. We're talking about millions of young lives saved. It's a monumental public health victory, and honestly, it sets the perfect stage for everything else we're going to look at today.
And it's always important to validate where we're getting our facts. We're drawing directly from the official 2024 SRS Bulletin, published by the Office of the Registrar General of India. This is a massive, large-scale survey conducted every single year across all states and union territories. It's literally the bedrock for public health policy in India. When you're talking about demographic shifts at this scale, this is the gold standard of data.
Moving right along to Section 2, the birth rate shift and how we measure population growth. Just to make sure we're all entirely on the same page, the birth rate is defined as the number of live births per 1,000 population in a given region and year. It's a fundamental measure of fertility, and it's a crucial determinant of population growth. Tracking this tells us exactly how fast a nation is expanding, which helps predict future needs for things like schools, jobs, and hospitals. Now, what's really wild here is the sheer scale of the drop. Back in 1971, the national birth rate was sitting way up at 36.9, jumped to 2014, and it had dropped to 21.0. But in 2024, it's fallen even further to 18.3. That is a roughly 13% decline in just the last 10 years alone. So India's fertility isn't just stabilizing, it's actively continuing a really significant downward trajectory across the whole country. But, as always, when you peel back a national average, you start to see distinct realities. Right now, the rural birth rate sits at 20.2, while the urban birth rate is noticeably lower at 14.7. Over the decades, that gap between rural and urban fertility has definitely narrowed, which is a fantastic sign of increasing development and access to family planning. But as these numbers show, the birth rate in rural India is still significantly higher than in the cities. Okay, on to Section 3. Declining national mortality, which is absolutely essential for public health.
Much like we did with the birth rate, let's lock down our terms. The death rate is simply the number of deaths per 1,000 population in a given region and time period. Why is this so important? Well, because mortality is a foundational component of population change. Tracking this shapes exactly how public health resources are deployed. A falling death rate generally means people are living longer, healthier lives, thanks to better medicine, sanitation, and nutrition.
Let's see how this actually plays out over time. Back in 1971, India's death rate was 14.9. By 2014, it had dropped dramatically down to 6.7. And over the last decade, leading up to 2024, it's continued a slow, steady decline to 6.4. Now, sure, the drop from 2014 to 2024 isn't as huge as in previous decades, but it represents a steady, sustained improvement in keeping the population alive and well.
Checking that rural-urban split again gives us a bit more flavor. For 2023 and 2024, the rural death rate has actually plateaued. It's held perfectly steady at 6.8. Meanwhile, in urban areas, there was a slight improvement, taking down from 5.7 to 5.6. It's a tiny difference year over year, but it hints at this ongoing, very real challenge of pushing cutting-edge healthcare improvements out of major cities and into rural communities.
That brings us to Section 4, saving the youngest lives. Arguably the ultimate health indicator. We're talking here about the infant mortality rate, or IMR for short.
This is the number of infant deaths, children who sadly pass away before their first birthday, per 1,000 live births. Global health experts pretty universally accept IMR as the ultimate barometer of a country's overall health. If a healthcare system is struggling, it shows up here first. But if it's succeeding, you see these numbers plummet. And the success story here? It is undeniable. Back in 2014, the IMR was 39. In 2024, it's 24. That's a massive 38% drop in just 10 years. And remember that crazy stat from the start of our explainer? That current level of 24 is less than 1/5 of what it was in 1971. The progress made in maternal health, institutional deliveries, and neonatal care is literally saving lives right before our eyes in this data.
When you break it down geographically, the really good news is that both rural and urban areas are sharing in this victory. Rural IMR dropped to 27, and urban IMR dropped to 17. Both of these areas have seen drops of over 35% in the last decade. Specifically, the rural rate dropped by about 37% and the urban rate by 35%. So the tide is truly lifting all boats here. But, and this is a big but, we can't let all this incredible progress blind us to the present reality. The SRS Bulletin includes a really sobering quote. It states, despite the decline, 1 in every 42 infants die within first year of their life at the national level. That immediately grounds us, right? A 38% drop is amazing, but a 1 in 42 mortality rate means there is an urgent, immense amount of work left to do to protect the most vulnerable.
Which leads us perfectly into Section 5. The Tale of Two Indias, and some extremely stark regional contrasts. Let's look at the absolute extremes, starting with the birth rate. On one hand, you have the state of Bihar, with a birth rate of 26.8. On the total opposite end of the spectrum, the Union Territory of the Andaman and Nicobar Islands sits at just 9.9. These are vastly different realities existing under the exact same national umbrella. A health policy that works wonders for the Andaman Islands would be completely out of place in Bihar, and vice versa. The contrast is just as sharp when we look at mortality. Chhattisgarh recorded the highest death rate in the country at 8.4. Meanwhile, Chandigarh recorded the lowest at just 3.9. Think about what that actually means for a second. Statistically, a resident in Chhattisgarh faces a death rate more than double that of someone in Chandigarh. The geographic lottery plays a huge, undeniable role in overall health outcomes. And this next comparison brilliantly and tragically illustrates the most staggering gap of all. Let's look at infant mortality at the state level. Chhattisgarh again shows the highest rate at 36. But then look at Manipur. Manipur's IMR is an astonishingly low 2. That means an infant born in Chhattisgarh is exactly 18 times more likely to die in their first year than one born in Manipur. It's a powerful reminder that while the national average is looking great, the local reality can be a totally different story. All right, as we wrap up today's explainer, let's quickly summarize what we've seen. The big picture is undeniably a story of incredible national progress over the last 50 years. The national birth rate is steadily down to 18.3, the national death rate has stabilized at 6.4, and incredibly, infant mortality plummeted by 38% in just the last 10 years alone. But as we literally just saw, this progress is paired with persistent, massive regional inequality. Which leaves us with one final, really provocative question to think about. As India continues to grow and develop, how does the nation bridge this massive gap between regions like Manipur and Chhattisgarh? How does a country of 1.4 billion people ensure that geography doesn't dictate a child's chance of survival? Thank you so much for joining me today to explore this data. I hope this explainer sparked your curiosity and gave you a clearer picture of what's really happening. Keep learning, keep asking questions, and I'll catch you next time.